Hi, everyone. It's Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area. And we want to talk about some of the latest headlines related to the coronavirus pandemic with Dr. Vanila Singh. She is the former chief medical officer at the U.S. Department of Health and Human Services and a clinical professor at Stanford School of Medicine here in the Bay Area. Dr. Singh, it's always good to have you on here. I think we should start with where the focus is right now in this country. And we are seeing protests all across the nation over the death of George Floyd at the hands of police in Minneapolis. There is anger, there is outrage, and people have taken to the streets. But of course, a lot of people have raised concerns about what this means when you have so many people coming together in the midst of the coronavirus pandemic, which is still happening here. What are the concerns that you have about the health and well-being of people who are taking part in protests?
Great to see you, Alex. Yes, it's such a challenging time in our nation, and to see the peaceful demonstrations, but certainly the looting and rioting that has caused so much concern, of course, makes a lot of folks concerned about our current, not resolved yet pandemic, which has led to the social distancing guidelines that are clearly not being followed by so many of those folks out there, especially those who are moving in very close quarters, going into stores in groups and walking on the streets. It's clear that those guidelines are not being followed by that group, and they're probably just not even thinking about that. I think the concerns and the ongoing racial concerns are correctly and legitimately being shared by those who are peaceful protesters. I've seen some folks, especially in the beginning days of this, where they were actually keeping a distance. However, much of this has been overtaken, as you know, by folks who are out there rioting and looting, and it's clear that the current country's health is not on the forefront there.
The mayor of, I believe it was Atlanta, she had a message that she put out to people who took part in some of the demonstrations over the last few days, and she urged them to go get a COVID-19 test because she was so worried about the potential for people to have exposure. Even though when you see the images, I mean, you do see a fair number of people wearing masks, which is what we should be doing when we're out in public. But again, the mayor there, she urged people to get a COVID-19 test. Is that something that you believe would be a smart thing to do for folks who have been taking part?
Well, I think that there folks who are out there, especially when they come into contact with their own elderly family members or friends, it is important to know that you could easily have been exposed in this time, and to take the precautions, perhaps even consider self-quarantining depending on how much in contact you have come with others, and also who in your family and friend circle are at risk. So I think that they have to be cognizant that they are potential vectors of transmission, and to be responsible and thoughtful. And it is very easy, of course, at this time to focus on the current issues related to the tragic death of George Floyd. But on the other hand, we certainly don't want them to forget that which we have been dealing for several months now in the country. And so I think that exercising caution, both if they're out of the house and out protesting for a number of different reasons, for your own safety's sake, but also for the public health concerns, but also to carry that forward into your own home.
Yeah, it's certainly good advice to be cautious, and can't lose sight of the fact that the coronavirus is, of course, still with us. With that being said, let's talk a little bit about how things, the economy, how businesses are beginning to reopen. Let's take here in California. I mean, obviously, California has taken a more cautious approach. How do you feel about the pace of reopening in this state?
Well, there are a lot of folks who are anxious to get their businesses open. We know hair salons, barbers have been unduly affected, as have so many other types of businesses. But the fact that we're moving forward, I heard about folks who are out dining and are happy to be out and about. On the other hand, there are folks in San Francisco that are dismayed a bit about the extension of the stay-in orders that the mayor there noted, as well as the extra caution on having masks even if you're 30 feet apart, which seems, to be at this point arbitrary. I certainly could not find anything in the literature, CDC guidelines, or really any guidelines that had that. So there might be rhyme and reason, but it's certainly not clear on what basis that is. I think that frustration comes along with some positive input that there is some progress in reopening.
Yeah, so you're referencing a rule that was put in place by the San Francisco mayor and obviously health officials in the city. That anyone who leaves their house is required to wear a mask if they're within 30 feet of someone else. Although I believe there's an exception, though, if you're exercising. So, I mean, I'm trying to make sense of that, and maybe you can help.
Well, it seems, to be quite frank, random. There doesn't seem to be any, at least, put forth reasoning behind exercising and not having to wear a mask, or walking and strolling and being 30 feet away and requiring the mask. So it seems like there's no foundation that I've yet seen in the literature, and certainly not in CDC guidelines, or really anywhere that I've noted around the country or the nation. So that is, I think, dismaying to some folks who were eager to begin to move forward. From my understanding, San Francisco's mortality rate still remains pretty low. Somewhere, the last I checked was 46, but it might be a little bit higher than that. And so that leaves some of the small business folks definitely behind the count in this.
Do you think there's reporting, at least some of the counties here in the Bay Area, seeing an uptick in COVID-19 cases since a lot of the restrictions around staying at home have started to be relaxed by state officials or county officials? Do you imagine that is going to continue? And do you think that is the result of the fact that more people are out and about necessarily, or is it because maybe there's just that much more testing happening, so we're learning about more cases?
It's absolutely more testing, without a doubt. That's every week has been ramping up since this all began. So there's no doubt that that's certainly going to play a role. And then you have to look at, number one, what was the actual goal, which was really to flatten the curve for the medical system, but also to identify high-risk folks, which we now know certainly are the nursing facilities, the assisted living. These are the areas where there's a high vulnerability. Certainly have accounted for a large percentage of deaths across the nation, specifically New York City, but certainly other areas. We know that's true in California. So the number of viral cases going up is something that we would expect with testing. I think Alameda County in particular, they've noticed a spike in cases there. It's important to monitor it. It's important to be a rapid response in terms of understanding what that is. Are there other trends? Is this an issue of disinfectant? Is it people not abiding by guidelines? Or is it just a result of improved testing? I understood one of those businesses there that they were concerned about where it was a Latino majority area. They went and they had their businesses redone in terms of disinfection and cleaning by professional organizations. So I think folks are definitely keeping an eye, and that's the way to contain this, is to monitor it, make sure there's no overtly bad trends, but especially keeping an eye on our high risk, high vulnerable populations, those in nursing homes and other facilities.
Yeah, we know the highest risk parts of our economy, our society, and we do have to, we certainly have to focus there. Nursing homes being one of those places. Appreciate you weighing in here, and we'll definitely talk with you coming up next week here and see what other headlines there are on the ongoing coronavirus pandemic in this country. We appreciate your time as always, Dr. Vanila Singh, who is the former Chief Medical Officer with the U.S. Department of Health and Human Services, as well as a clinical professor at Stanford University. Always appreciate your time and your insight. Thanks for coming on. And I'll let our viewers know that we have more information up at the website coronavirusnow.com. I'm Alex Savage from KTVU Fox 2 News in the San Francisco Bay Area, and I'll see you next time.